Welcome to a PreventConnect podcast, where we explore the prevention of violence against women. This is a project of the California Coalition Against Sexual Assault.
Hello, everyone. It's a pleasure to be here. I'm David Lee from PreventConnect. It's great to see so many faces and names of people who I know and to meet so many of you here. Today's web conference, PreventConnect is co-hosting with our partners at the National Resource Center on Domestic Violence. This is the economic cost of intimate partner violence, implications for prevention. PreventConnect is a national project of the California Coalition Against Sexual Assault, sponsored by the U.S. Centers for Disease Control and Prevention. The views and information provided in this web conference do not necessarily represent the official views of the United States government, the CDC, or CalCASA. What we'll be doing today is talking about three objectives that we're going to do. We want you all to be able to describe the key findings from the Lifetime Economic Burden of Intimate Partner Violence Among United States Adults report that was just released last month. We want you to be able to identify opportunities to use that data, and we want you to describe the implications for prevention. So I do want to start with a little poll that I'm going to go ahead and ask. In the lower left-hand corner, you'll see a piece, and A, B, C, or D. Do you know about this report, Lifetime Economic Burden of Intimate Partner Violence Among U.S. Adults, before this web conference? So go ahead and click the one. A, you've read it or skimmed it. B, I saw the title in the registration. C, I've seen the title outside of PreventConnect. Or D, I've never heard of this report before. And so it's interesting to see as I'm waiting for the results. Let's go ahead and share the results. We're sharing the results. Interestingly, more than a third of the people have never heard of the report before, and it's great to have you here. I see that many of you, there's about 20% who actually read or have skimmed it, and that there's another quarter of you who have actually seen it from the title, or about 11% of you have actually seen it elsewhere and learned about it. So I'm glad you're here to join us, and we will be covering the information, and I'm going to strongly encourage that you get a chance to read the report. It's actually available online free for this month only, and then you'll have to wait 12 months before it becomes free. Now, this is part of research of understanding the lifetime economic burden of different types of social problems is an important part of understanding what we're going to do. And last year, one of the authors, Cora Peterson, who you'll be meeting very shortly, was one of the authors of a report that was about the lifetime economic burden of rape among U.S. adults. And Tori just put a link to that so you can get a copy of actually the full source, the full text of that. And it was a really useful study to give a sense of what we see the cost is. When we talk about issues of sexual assault or domestic violence or intimate partner violence, it's important to understand what the cost is, because that gives us information to help drive policy and think about how we can be able to make things different. And we'll be talking about that in greater detail. And so this one was done last year. And in California, I had the privilege of working with Dr. Ted Miller and Dina Fulton in putting together a report where we did the cost and consequences of sexual assault in California. And so we were able to do this. This has also been done in several other states. I know that in Minnesota, in Iowa, they've put together really good cost of sexual violence reports. And it's been really helpful in being able to help drive funding towards the services, and it's been really, especially around our focus around prevention, it's been really able to highlight the value of prevention resources. So in California, we then went over and made the case for prevention and really talked about how to make a case for prevention, investing in the California Free from Sexual Violence. We actually ended up partnering with our Domestic Violence Coalition. I see we have some people from the California Partnership to End Domestic Violence in being able to do a policy ask to be able to try to be able to get funding for prevention services and making that investment in prevention. We want you to think about how we can be doing that with the report that we have here. So to get in our next piece of, I want to have Kenya Fairley, who's with the Division of Violence Prevention and Services over at the U.S. Department of Health and Human Services, DIPSA as the acronym for those of us who are familiar with it, but I'm trying not to just say acronyms. And so Kenya being over at the PIPS office at HHS, Kenya, can you, I'm going to hand the podium over.
I'm here. I'm ready.
A few thoughts. Great, Kenya.
Yeah, absolutely. Thank you so much for that, David, and thank you for everyone that's here on the call today. As David said, my name is Kenya Fairley. I'm the Acting Director of the Family Violence Prevention and Services Program, located here in the Family and Youth Services Bureau in the Administration for Children and Families at the U.S. Department of Health and Human Services. I'm really pleased to be a part of this presentation today on this latest study, The Economic Cost of Intimate Partner Violence, Implications for Prevention. I want to especially thank our partners in this continued work to eradicate intimate partner violence, the National Resource Center on Domestic Violence, CalCASA's PreventConnect, and of course the CDC for their ongoing dedication and commitment to conducting high-quality research in this area. DIPSA truly believes in promoting interventions that are grounded in evidence and that can be tailored to the risk and protective factors of diverse individuals. We strongly believe in providing trauma-informed services and environments that allow for healing and recovery from violence, abuse, and neglect. So we work intentionally with all of our grantees and our federal interagency partners to address intersecting issues of trauma and oppression, to ensure that all persons victimized by intimate partner violence are adequately served to meet their unique needs based on their identity, their culture, and their lived experiences. Having a deeper understanding of the economic cost associated with providing life-saving services to those who've been victimized will help us be better stewards of public funds and will also help us do our one thing to improve how we leverage federal partnerships and resources. So as we learn more about the social determinants of health, we're also understanding that our healthcare systems will save more money by prevention of illness and these types of crimes rather than ongoing costs to care for those who are impacted by these crimes and subsequent illnesses that result from that. So through this presentation, I look forward to hearing more about what this means for our work across the field and our work here on the federal level. So thank you all for your time today and your dedication to ending violence in your community. I'm going to pass it back over to David.
Thank you, Kenya, and I'm really glad to have you being able to join us today. I'm now really pleased to be able to introduce our guests who will be speaking, and we are going to be joined by some of the authors of this report. We are joined by Megan Kearns, who is with the National Center for Injury Prevention and Control, the Centers for Disease Control and Prevention. Hi, Megan.
Hi, David. Thanks for having us present today.
It's a pleasure, and we're also joined by Cora Peterson, who I referred to earlier, who is also with the National Center for Injury Prevention and Control at the Centers for Disease Control and Prevention. I'm trying to avoid my acronyms, so I'm not saying CDC. But how are you doing today, Cora? Cora, you might have had the mute on your phone.
I have unmuted. Hi, David. Thank you.
Great, thank you. And we'll be starting with a presentation that Megan and Cora will be giving, but then we're going to be followed by our partners at the National Resource Center on Domestic Violence, and we're joined by Ann Menard. Hi, Ann. How are you?
Hello, David. Glad to be here.
Wonderful. And we're also joined by Arlene Vassell. Hi, Arlene.
Hi, David. And I'm also excited and glad to be here and to share my one thing.
Great. Well, I'm really glad, and it's important. And so Ann and Arlene will be talking about some of the implications about how to use this and about the resources that are available. And it's been, for us, important to really collaborate with the National Resource Center in being able to help provide some support for all of you. So with that, I am going to start with the audience, of course, which, as we often do at PreventConnect, and I want to hear from all of you. Why is it important for you in your role to consider the economic cost of intimate partner violence? So go ahead and write in your text chat on the right-hand side of the screen, why is it important in your role to consider the economic costs of intimate partner violence? So I'd love to see people write into the text chat and be able to hear about why it's important for you in your role. And so we're going to go ahead, and people are going to be able to. Jody says, money speaks. Community awareness is the key. And now people are starting to go faster. So help recruit partners and justify grant applications, training and presentations with businesses. We've got people that are to leverage funding, to get people invested, to show the full impact, and being able to have the implications to towards systems change. Thank you, Vivian. Prevention in bold. Fundraising. Prevention with Alejandra. Prevention with an exclamation point. Prevention education to leverage funding. So I'm seeing a theme about leveraging funding, leveraging support for prevention to increase funding to bring businesses. I'm noticing that other theme there. So we can compare different costs. And that we're often being asked, as a data specialist, being asked to understand this, to be able to understand the issue better. And that cost is one of the barriers that survivors face, and to communicate the impact when we communicate with the community. So Anne and Arlene, looking at this list, I see several of the themes about fundraising, making the case, and prevention is what I'm hearing a lot of. So with that, I am going to hand the podium over to Megan Kearns. And Megan, you're going to start with talking about the study that you've done, and we'll be coming back to our audience soon. If you have questions during the thing, go ahead and put them in the text chat, and we'll be getting to those questions either during the presentation or at the end. Hi, Megan.
Hi, David. Great. I'll get started. Thank you so much, and thank you for everyone who is joining us today. We're really excited to share the findings and hear feedback from everyone. I'll start by just kind of giving an overview of intimate partner violence. I assume many of you are very familiar with these statistics, but for those of you who may be less familiar, obviously we know intimate partner violence is highly prevalent. Approximately 27.4% of women and 11% of men have experienced IPV in their lifetime. Importantly, we also know that the burden of IPV is not shared equally across all groups. Many racial, ethnic, and sexual minority groups are disproportionately affected by IPV. We also know, and this has relevance to what we're going to be discussing today, that the health and economic consequences of IPV are substantial. So apart from physical injury and death, there are also many other adverse health outcomes associated with IPV, including a range of physical health outcomes, many of which are chronic in nature. Survivors of IPV also experience mental health consequences such as depression and PTSD. IPV survivors are also at high risk for engaging in health risk behaviors such as smoking, binge drinking, and HIV risk behaviors. Furthermore, a substantial proportion of survivors also report other negative impacts, things like fear, concern for safety, missed days of school or work, or needing services as a result of IPV. And there's a wide variation in the proportion of female and male survivors reporting these impacts. So just to give some background, past efforts to estimate the economic burden of IPV include a CDC publication from 2003. That report estimated $5.8 billion in costs each year related to health and lost productivity costs. However, the study relied on data from 1995, so at this stage the estimate is over 20 years old. In addition, there were several major limitations. Some of these limitations included a focus on short-term or acute costs that are experienced in a one-year time span, and so it didn't capture that lifetime cost perspective. It also didn't include criminal justice-related costs, which are substantial. And furthermore, this previous CDC estimate was limited to female survivors of IPV and did not include male survivors. So we hope to improve upon these past estimates with the current project. The purpose of this project was to identify the lifetime per victim cost and the overall economic burden of IPV. We hoped with this effort to expand upon those existing estimates and provide a more comprehensive estimate by including costs across the lifespan and incorporating a broader range of outcomes. This is really important because identifying accurate cost estimates are important to establishing and communicating the public health burden of IPV. We also use this information when conducting economic evaluations of our prevention efforts to demonstrate the cost effectiveness and that return on investment that many of you were referring to. So, what is a per victim lifetime cost? There are many different ways to describe the cost of a health-related experience. In this study, a per victim cost referred to the economic costs that are experienced over a person's lifetime that result from their exposure to IPV. If you put it a different way, the cost estimate would also reflect the potential cost savings from an intervention that helps a person avoid exposure to IPV. previous studies largely have not been able to account for long-term health experienced by survivors. So to give you some background on this project that was started by CDC, it began as a contract that was modeled on a similar project that David referred to earlier, a paper that produced a cost estimate for rape that was published last year. In fact, we worked with the same contractors. Our contractor was Quality Resource Systems, Inc., and they helped work with us over a 2-year contract to identify, synthesize, and analyze estimates of the marginal effects of IPV on key outcomes and costs. So this was a literature review primarily. It didn't involve any original data collection. It was started in September 2015 and recently ended last year. And I just want to recognize our collaborators from the contract, Dr. Christina Nicolaitis, who led our health outcome literature review, and Dr. Catherine McAllister, who led the cost literature review. So to give an overview of our method, and again, the project started by conducting a targeted literature search to identify IPV outcomes and associated costs. And the criteria for inclusion was based on the strength of the study design and how well it represented the U.S. population. Some of the outcomes included both acute, long-term, and criminal justice costs. So among the acute costs, we included things like victim property loss or damage, physical injuries, rape-related pregnancy, lost productivity, and victim fatalities. Among long-term outcomes, we included obviously mental health outcomes, substance abuse, physical health outcomes, and then finally among criminal justice costs, it also included perpetrator lost productivity. From this literature review and using the results, we were able to calculate the marginal effects for each outcome. So basically what that means is it's the proportion of victims with an outcome that goes above the proportion of kind of the general population that's reporting the same outcome. And then we use that information to attribute a cost per person. I think it's most helpful when we're talking about this to give an example, and so that's what you see on this slide. This table shows our findings related to depression outcomes among women. Our review of the literature showed that 31.2% of women without IPV histories report experiencing depression over the course of their lifetime. In contrast, 46.5% of women with exposure to IPV report experiencing depression. So what we're really interested in is that difference between the two rates. So 46.5 versus 31.2%. The difference that we see here, that marginal effect, is 15.3%, and that is what we use to calculate costs. So then what we would do is use that percentage and apply it to costs associated with depression to identify the burden specifically caused by exposure to IPV. I'm going to pause here because that's a lot of information and it can be a little tricky to wrap your mind around, so I'll just pause. I'm not seeing any questions immediately popping up in the text box, so I'll keep going. So with the marginal effects, once we had those, we calculated them separately for female versus male IPV survivors, and then the cost per person estimate was then multiplied by the total number of individuals reporting a lifetime exposure to IPV. Where we got that number is from our CDC surveillance system, the National Intimate Partner and Sexual Violence Survey, which many of you may be familiar with. And for this study, we used the 2012 data on lifetime prevalence of IPV exposure. Specifically in this study, we used the definition that includes contact sexual violence, physical violence, or stalking by an intimate partner with related impact. So moving on to our findings. Based on our current report, what we identified was that the lifetime per victim cost was $103,767 for women and $23,414 for men. This, as you may notice, is a fairly different estimate for men versus women, and a lot of this reflects differences in outcomes such as rape-related pregnancy. It also reflects differences in the number of affected victims by sex for particular outcomes. And then also it was influenced a little bit by limited research that included male survivors. Overall, however, the study showed a lifetime economic cost to the U.S. population of $3.6 trillion. That includes the 32 million women and 12 million men who are victims of IPV during their lives. Just to break this down a little bit further, what we identified from our study was that $2.1 trillion, or about 59% of the overall economic burden, was attributed to medical costs. We found that about 37% was related to lost productivity among both survivors and perpetrators. About $73 billion was attributed to criminal justice activities, and then $62 billion in other costs such as victim property loss or damage. From this, we estimated that government sources pay an approximate $1.3 trillion of that economic cost overall.
Megan, we had a question about, had previous studies looked at the criminal justice costs?
This was new for our CDC reports. I think, David, you might be able to say more about the California and some of the state reports that have looked at costs of these different types of violence, but the previous CDC report from 2003 did not include criminal justice-related costs.
In the sexual assault ones, generally they are including the criminal justice costs because we can see, and obviously from this study here, we're doing that. And I also see several people have been asking if we can get a copy of the presentation, and Tori has been posting. It is on the PreventConnect website right now, so you can follow along if you want. Thank you, Megan. Move on to the next slide. My tweet I just sent was $1.3 trillion. So that's pretty powerful.
Yeah, it's hard to wrap your mind around. So it's important with a paper like this to give some overall context on how these numbers were derived and what limitations there are in our ability to estimate a more precise cost for IPV. Like we said, this was an opportunity to improve on our previous report from 2003 by including, for example, costs associated with male survivors of IPV, including criminal justice costs. But there are some important things to consider related to our current findings. So one limitation that we had for this report was inexact timelines related to intimate partner victimization during a person's lifetime. So knowing things like the number of victimization experiences per person, the number of survivors per perpetrator, when these health outcomes are first appearing in terms of a person's lifetime experiences, and how treatment of those related conditions impacts the cost. These are things that are inexact and hard for us to factor into the current findings. So it's something where there's an opportunity potentially to improve as more research and information becomes available, but that's something to consider. In addition, the study used acute cost estimates in some cases per victim rather than per victimization. So, as we know, many survivors experience multiple incidents of IPV, and so that would underestimate the consequences for those survivors. A lifetime cost of some outcomes had to be inferred from annual cost data, which is a limitation. It assumes kind of an accurate distribution of patients at all stages of an outcome when we're looking at just annual estimates and costs. In addition, owing to available data, this study didn't address costs among specific subpopulations of survivors, and that's really unfortunate since we do know, as we mentioned earlier, that there are health disparities related to race, ethnicity, or sexual orientation, for example, that may greatly impact the economic burden felt among certain groups. We were able to separate costs for female versus male survivors, so that was something that improved upon our previous studies, but some of these outcomes that were relevant to female survivors hadn't been assessed yet among male survivors. So one example of this was blindness. That was something where we had data for female survivors and what those effects are for women who have experienced IPV versus not, but we didn't have that for male survivors, so we weren't able to include it. The study also didn't include IPV effects on non-rape-related pregnancies or on children exposed to IPV. And, those are clearly associated with IPV in the literature, such effects such as higher prevalence of preterm birth or child abuse and neglect. We didn't have population prevalence data that made it very difficult to calculate how those things add to the cost related to intimate partner violence. So this is another area where inexact timelines can become challenging, not knowing whether a lifetime history of IPV impacts pregnancy outcomes the way that we know that current IPV does. For this study, we also had to assume that IPV was the cause of the higher outcome prevalence among survivors. If in fact it was due to other risk factors, then this study may have overstated the cost to IPV. Another important note is that the cost doesn't include impacts of IPV on family, friends, employers, etc. And that's important too. We know, for example, that witnessing IPV is an adverse childhood experience, and there are likely many negative impacts on loved ones who have had their lives impacted by a loved one's IPV. So that's not included in these costs, and it's an important limitation to mention when we're thinking about the overall economic burden and how this impacts our population as a whole. There are other limitations that are outlined clearly in the paper. I just wanted to kind of highlight a few as we think through the findings and also the opportunities that we have in the future to continue to build on our research and evaluation information and really start to further disentangle this so that we can continue to get more and more precise in our ability to estimate these costs.
Great. Megan, there's a couple questions I want to just get to clarify.
Sure.
This report is titled about the findings for adults, but can the question that was asked was, did it include teen IPV experiences? Can you talk about, what you asked and how you included forms of IPV that might have taken place before they were adults?
Yeah, that is a really great question, and I'm glad that someone brought that up. I think we'll circle back to this a little bit later, but this economic burden estimate does represent costs over a person's entire lifetime. Therefore, it includes costs already experienced among older living adult survivors and future costs among younger living survivors. So it would take into consideration a lifetime history of teen dating violence or relationship abuse in early adulthood. It is not limited only to adult experiences.
Because the question is drawing from the data from the NISVIS report, which asks adults if they've ever experienced IPV in their lifetime.
That's correct.
Right. Okay, and then there's another question about some of the subpopulation the question was asking, will CDC start measuring factors? But in this study, actually, you're drawing on what literature exists. So do you know about ways to get better information around other subpopulations and family and friends for the future?
Yeah, I think that's a great point as well. And absolutely, this was really what we were able to do based on the existing literature on IPV, and we really tried to comb as much of it as we could possibly do to identify specifics. But what would be important is kind of similar to how we were able to break down female versus male costs in this particular report, even though there are some gaps in what's been studied among male survivors. And we were able to get a little bit closer to being able to separate it out and identify, what the different economic burden is for women versus men. That would be something that would be needed for other populations. So really having a sense of, within that population, what are the impacts of IPV on all these different areas, physical health outcomes, mental health outcomes, how is it different? Are the effects larger or smaller depending on who you're talking about? So I think we'd be really challenged as an entire field to think about how we can continue to collect better data and be able to report on our data in a way that clearly shows how some of these burdens are experienced differently by different groups. And with that information, we can add that back into our calculus.
Great. Well, thank you. I believe, Cora, I'm now going to you.
Yes, thank you, David, and thanks to Megan for that great summary of our report and its limitations, and thanks to the audience members for your questions. We look forward to more. So turning to how can I use this estimate? Again, this study estimated the per victim lifetime cost of intimate partner violence, but another way of thinking about this cost is that it's the estimated cost averted for each potential victim who does not experience intimate partner violence. In that way, this cost measure, which as Megan indicated was dictated by available data, it is one that is powerful for prevention because it allows us to assign a value to those prevention activities. A limitation, though, is that we cannot, for example, estimate the annual cost of IPV from these data and results. How is this estimate likely to change in the future? Well, the per victim estimate could change based on new information about victim outcomes or unit costs. And as that information becomes available, we have built a model flexible enough to accommodate those types of changes in the future. The lifetime economic burden of IPV, that $3.6 trillion figure, will remain relatively stable. That's barring any dramatic changes to the per victim estimate. And this is because this $3.6 trillion population estimate is based on the number of adults who have reported lifetime exposure to IPV, and such a large population experiences only modest and incremental demographic changes. Why shouldn't I use this per victim cost to estimate an annual cost? So the economic burden estimate, this $3.6 trillion estimate, represents costs over victims' entire lifetimes. As Megan referred to earlier, this cost estimate includes costs that have already been experienced among older living victims of IPV, and as well as future costs among younger adults. The NISFIS survey does include a prevalence estimate of the number of adults who experienced IPV in the previous 12 months, but we don't have information about how many of those adults were first-time or new IPV victims. So if we were to apply this study's per victim cost estimate to that 12-month data, we would overestimate annual costs. And now I think we're back to Megan for an explanation of how to calculate state-level data from these results.
Okay, there. Megan, now you have the podium.
Great, thanks. So, maybe I missed a slide. Oh yeah, okay, here we go. So can I use this estimate to calculate my state's economic burden using data from our NISFIS state report? The answer to this is yes. And you can calculate your state's burden by multiplying the number of IPV victims by state times that lifetime cost per victim. One note that I want to make here is that it's important to use state-level data that utilizes a similar IPV definition as this study. So again, the definition we used from NISFIS was contact sexual violence, physical violence, and stalking by an intimate partner with impact. So an impact could include something like injury or missed school or work or fear, things like that. And just to give you an idea of how you might go about doing this, we thought it might be helpful to walk through an example. I don't know if we have any folks from Alabama on the phone, but your state got nominated for a little example here. And this, if you're familiar with the state report or you're not familiar, and we've included the reference down at the bottom, and you would utilize inputs from that report from specifically Table 5.7, which reports the total number of female survivors with IPV-related impact. So in Alabama, that number was reported as 613,000. And then you would pull data for men from Table 5.13. And according to the state report, 182,000 men in Alabama reported IPV with related impact. So using that information, and that would direct you where to go if you're interested in calculating your state's burden.
Yeah. So Megan, to make this even easier, Ann and Arlene, National Resource Center for Domestic Violence, have a way to make this easier for people?
Yes,
Hi, David and Megan. This is Ann from the National Resource Center on Domestic Violence. We had hoped to do these calculations for each of the states, and we just had too many spinning plates on polls this week, so we didn't get it done. But we are going to get it done certainly within the next week, and we will make sure it gets posted on all of the coalition listservs, and we'll also make sure David, Ashley get a copy, and they will send it out to all the folks who register for this conference, or register for this webinar. Okay? Thanks, David.
Great. So, Megan, now you can go ahead and talk more, but we are going to make it easier.
Yeah, no, that sounds great. Thank you so much, Ann. I think that's going to be a great resource. And then, for folks who are able to access NRCDV's resource, they'll be able to look back at this and see the methodology. So, again, you would just multiply the numbers in your state by that cost, and you come up with, in this example, a total lifetime burden for Alabama. We've already done yours for you. It's $68 billion in 2014 dollars. So I'll pause here and pass it back to David.
Okay, well, great. Well, thank you. I'm going to get a couple questions. Before I do this, I'm going to jump back. I got a couple questions that I want to make sure we can get to. This was a little technical, but I know exactly where Kristen's going with it. Are you able to do cost to Medicaid in particular because of being able to know how much Medicaid expenses around IPV? Because we see some women we know how many percentage of women actually qualify, and she also wants to highlight it's important to continue to look at pregnancy-related outcomes because of preterm birth and neonatal intensive care costs are big expenses to public health systems. So is there anything about how you were able to celebrate Medicaid, or is that just included in the numbers?
Megan, I can take that one. It is a very good question, and it's one that we often get with our cost analyses. For this particular analysis, we were not able to break out a Medicaid cost because the mix of medical expenses just didn't allow for it in the data. We are aware that this is a topic of interest, and we always try to do it, and we'll keep looking for opportunities to make those refinements to this data going forward.
Great. And then this might be you, Cora, also, and I really encourage you to go to the report, and you'll see all of the backing data that's in here, but just, where they can get those data sources and how many of those data sets are publicly available or accessible to people. So I know you list all the data sources in the report. I don't know how much you can say about what's publicly accessible or not of those data sources.
Yes, definitely. And for this report, like the previous similar report on the economic burden of rape, we published supplementary Excel files that demonstrate 100% of the data that was used for the report, as well as all of the calculations. So that supplemental file is available on the journal and the publisher's website. I don't think you have to dig too much for it, but what you're looking for is a supplemental file. It's a set of Excel files that would allow anyone with that level of interest to delve quite thoroughly into our calculations and the data sources. And David, I also am remiss because I didn't address the question about cost to look at pregnancy-related outcomes. That is definitely of interest, and we will keep looking for opportunities to implement that element in future versions of these cost data. As Megan mentioned during her presentation, this is something that's established in the literature. There are cost estimates out there that are associated with pregnancy-related outcomes and impacts on children. What's lacking is the population data on, for example, the proportion of pregnancies in a given year where the mother has been affected or exposed to IPV during pregnancy. So we're facing a data issue with the population that we would apply those numbers to. And again, we're looking for opportunities to include those costs in the future.
Great. And then we also had a question about military, and is there any ways of getting information in particular around military?
We did not look into that specifically for this report, in the same manner that Megan has described, that the per victim cost estimates can be applied at the state level. In theory, any subgroup, such as military, where it's known the number of individuals who have had lifetime exposure to IPV, this per victim cost estimate could be applied. It's not something that we did in this report.
Right. Though NISVIS did have data that did specify for people in the military, so that is there was a report that had been done with DoD using NISVIS data, if I'm remembering correctly. Well, great. Let's move to the audience to hear about you. This is sort of coming back to the question we had earlier, but let's think about how do you see, now that you've been seeing these numbers and the immenseness of this, how do you see the economic costs of IPV affecting to your work and your role? So now that you've gotten this data, how do you see, we got some sort of general ideas before, but I'd love to hear from all of you about how you see the economic cost applying to what work you're going to be able to be doing. So I'd love to see some responses as you think about, as you get that, how do you apply this to your work and your role? Earlier people talked about this will be helpful for fundraising, this will be helpful for prevention, for building partners, and so I'm seeing that theme already coming up. People are already going to their funders, and they're already with their businesses and workplaces and working on getting buy-in and being able to show impact and policy advocacy in addition to fundraising and prevention program, and it's to include this in training so people can understand the impact. Great. So with this, I'm going to hand the podium over. I believe I'm starting with Ann, right? So I think I'm going to, so let's go ahead and, or no, actually, is this still IPV? Is this still you, Megan?
This is still me.
Still you, Megan.
Yeah, this is just a wrap-up slide, though, and I think it maps on nicely to some of the conversation in the text box. I mean, again, implications of this. We know that IPV is a significant problem, and it can result in short-term and chronic and physical mental health consequences. The study really highlights that economic burden to both victims and communities. The average per-person measures, we hope, will help us estimate the overall economic burden of injuries and health, and we use this to show the value of our population-based prevention programs. So we are excited to be sharing this with everyone, and we hope it will be useful for these various purposes. And I just wanted to end on a slide with our citation. I know that the link to the article has been posted in the text chat box, so I just wanted to include it here. It's online, available now, and I'll just put in a plug again that it is available from the publisher for download for free right now, but only for a short time. So get over there and download it, or tell your colleagues to download it while they can access it for free.
Great, thank you. And I did get a private chat question about is there any data around non-gender conforming or non-binary folks, because your data was referring to men and women, and so how you can talk about that?
Yeah, I think that that's another great example of a subpopulation, and there's reason to believe that there may be differential impacts in terms of physical health consequences, mental health consequences. All of these different things may vary, and so we need more data on those kinds of populations to better evaluate, are those effects greater or lesser, and in what ways, in what areas. And the more data that we have, the more we can start to better understand how the costs might vary. Just as with this study, we were able to separate out men versus women to see how they differ in these different ways. So I think the answer is we need more data.
So now I'm really happy. So for CDC, be able to contact information. Someone asked, is CDC prioritizing IPV research moving forward? And this is a way to be able to see some of the work that CDC is doing around their research around intimate partner violence. So I'd like to now move to Ann Menard and Arlene Vessel talking about some of their work. So Ann, I believe you're starting?
I am. Thanks, David. And I want to start by really thanking Megan and Cora, not only for doing this study, which, as you know, I think you all appreciate was very complex and required a real lot of work, but also agreeing to have this webinar and to, you know, provide the additional explanation that you have done so already. And again, just real appreciation to you both. I'm going to take a few minutes to reflect on why these updated cost estimates for IPV are so valuable to us as advocates and also as allied organizations, because I know that there are many allied organizations as well on the call. And then Arlene is going to provide some compelling examples of how we can tell the prevention story and incorporate these kind of data, as well as some other human aspects of a good prevention story. So please feel free to use the chat, and David's going to be monitoring that and will interrupt us if there's a compelling comment or question. And we are not seeing the, can you just advance the slide, David, for me? We'll just do that. Thanks. So why are these IPV cost estimates so valuable to us? As Megan and Cora shared, the headline finding is the lifetime cost of IPV is $103,700 per female victim and $23,000 per male victim, or $3.6 trillion. We don't often see that kind of number connected to our work. So how do we use this data as part of our prevention storytelling? These cost estimates tell us that intimate partner violence is very costly for individuals and families as well as society as a whole. And making sure that all victims of intimate partner violence have a place to turn for help while also investing in prevention will protect lives, reduce harm, and save money. Remember, it's not intervention or prevention. That's a false choice that we're often sort of pushed into making, given the present reality. It has to be intervention, responding to the current danger, harm, and pain that survivors experience daily, and prevention, stopping it from happening in the first place. So this cost data can be used to make both those cases, and we need to try to keep them together. In addition to using the data to promote investment in both intervention and prevention, or as one of our participants said, money speaks, so many of you picked up on that immediately. I want to point out some of the other important elements of this cost data and how they can be used to shape both our policy and our practice. You could go to the next slide, David. So again, we have a finding that IPV has a range of impacts and associated costs: injuries, fatalities, acute and long-term health and mental health impacts, and that's a significant portion of the cost. Lost productivity for both victims and those who have caused harm. Again, another significant 37% of the cost burden. Criminal and legal systems costs. That was actually lower than I expected, but there it is. And property loss and damage and other types of costs, again, on individuals or families, communities, society. So these cost estimates underscore for us and for people that we're talking to and in trying to engage in our work that the impacts of IPV are broad and multifaceted, and that our intervention and prevention efforts must also be broad and multifaceted. This data is a call to action. This data on this slide and on all of the different slides is really a call to action, that there's a role to play, that there's a role for everyone to play in IPV prevention. So I think the way that the detail of this data gives us some additional tools to reach out to folks who are still skeptical that they have a role to play or that this issue touches them. Before leaving this slide, I want to appreciate that CDC included earnings loss not only for victims but also perpetrators, or language that we're beginning to use, those who have caused harm. The costs, particularly due to incarceration, and survivors have taught us that this earning loss has both short and long-term economic security implications for many survivors and their children, as well as communities. So when we are using incarceration as a primary response to intimate partner violence, that has economic costs, again, that are reflected, that captured in this cost study. It also needs to be understood in the context of racial inequities we see about who gets arrested, who gets prosecuted, who gets incarcerated. So again, my appreciation that the cost data captured this aspect of what the kinds of things that we also need to pay attention to and the kinds of dots we need to connect in both our intervention and prevention work. Go to the next slide, David, thanks. Another finding that I thought was interesting and useful as we message around prevention is that government sources paid for about 37% of the economic costs of IPV, $1.3 trillion. That's a big number. But the costs of IPV are borne at every level of government, but it's not just government. Clearly, there's only 37%. So we're also needing to talk to private funders, businesses, communities, families, and individuals. The costs are also borne at all of those different levels. And I think some of the comments that the participants have already provided about where they see taking this data, using this data, you picked up on the fact that this is a way to engage a broader set of funders, also to reinforce the important role that government needs to play, but to also reach out to some other funders because it's going to take more resources. And I think this estimate also helps underscore that better responding to and preventing intimate partner violence requires commitment, cooperation, and leadership across a range of sectors. So Megan, you can go to the next slide, David, thanks. Megan and Cora made brief reference to the IPV, the CDC's Intimate Partner Violence Technical Package, and there's a picture of it here. And I want to call your attention to it as well. I don't know how many of you on the call are familiar with this document, but I commend it to you as an important complement to the cost study. The technical package includes strategies with a focus on preventing IPV from happening in the first place, as well as approaches to lessen the immediate and long-term harms of IPV. The technical package provides the research and practice evidence for both of those types of strategies. And you can go to the next slide. And identifies a broad set of evidence-informed IPV prevention opportunities. And so the technical package is very useful in, again, broadening our understanding of what, when we do these things well, can have a protective factor and reduce the incidence of intimate partner violence. So they include comprehensive, affordable, accessible health care and mental health care systems, responsive workplace policies. There's evidence to support responsive workplace policies as an IPV prevention opportunity. Strong economic supports for families, including work-family supports and safe housing options. One of the participants identified saw an opportunity to use these the cost data to support the need for housing for survivors, and you're absolutely right. And the technical package provides you some additional research to help you make that case that you can combine with the cost estimates. Another prevention opportunity are efforts that eliminate inequality across gender, racial, and ethnic and income groups. So there's some important language that identifies racial equity work, gender equity work, and economic equity work as important prevention strategies. And also support for survivors to increase safety and reduce harms, the work that many domestic violence programs and coalitions on the call today are engaged in every day. So this is what prevention work looks like. And this is a broader picture than we've had before, and we have more evidence both from this cost study and the technical package to support that.
And Ann, just to note, we put in the text chat the link to the report, to the technical package, and also our PreventConnect web conference where we had the authors of the report sharing the findings.
And I see our colleague from the California Partnership to End Domestic Abuse and Violence is talking about how the technical package, noted that they're using the technical package to really guide some of their prevention efforts. So thank you for that. So this is my last slide. So there are many, and just a point I want to make, is there are many health, safety, and equity reasons to prevent intimate partner violence. This study provides us another, which is that if we reduced and I just picked a half, but you can put any number in there, by a half, the current number of women, which is at 32 million, and men, 12 million, who are victims of intrapartner violence in their lifetimes, we would reduce the cost to individual victims and society by $1.8 trillion. So, and before turning this over to Arlene, I just wanted to say again that we are working on a chart that would highlight how these cost estimates translate into individual states using the NISFA state data and the formula that the cost study includes. And we will let you know when that's available, because that allows you to talk not just with the national numbers, or you may want to do that, but to reflect your state numbers. Okay, I'm going to turn it over to my colleague, Arlene.
Okay. And David, do I have, how do I move the slides? If not, I'll just ask you to do the same for me, David. So,
you should have it now. It should appear on your screen.
Okay.
There it is. There it is.
Okay, I see it. Okay, perfect. All right, thank you. All right, so again, I'll ditto what Ann says, everything Ann said in regards to thanking the CDC for this. I think this is invaluable information that we definitely can use, as folks have already mentioned, to incorporate in our trainings, our policy advocacy, grant applications, engaging with new and old friends and partners. So again, thank you for this. So now that you have all this information about the cost study, key findings, technical package, now what do? How do you organize the information and communicate your key points to your intended audience? What I'm going to do over the next few minutes is offer some nuggets and guidance and examples of how the NRCDV, how we've done that here, and how some of our friends across the country have also done that. So let's think about elevator speech. Let's think about moving individuals from increased knowledge to action in 60 seconds or less. Sometimes that's all the time you have. Sometimes you have more time. But as you're planning your messaging, it's important that you keep in mind that you want to create a message that you can articulate to your key constituents, and you also want folks to repeat your message in the community as well. So yeah, let's think about that, and let's think about the message. The ultimate goal of the message is creating a prevention story that connects the dots for your intended audience. So the prevalence data, the serious impacts, economic burden, and also it connects your audience to the issue. You need to be intentional about creating a story that pulls on the emotions of your intended audience, as well as inspire hope. So in order to accomplish that, you need to know who your audience is. So you have to do a lot of homework about your audience, their level of knowledge, interest in the topic, personal interests, values, and all of that. It takes time, of course. So as you're crafting your story, your hook, and your key points, something I want you to always remember is your 3 C's, right? Your message has to be clear, concise, and consistent. So you want to choose familiar words that decrease the likelihood of misinterpretation, and provided some great talking points, and I'll also direct you to some talking points that we've created at the NRCDV. Concise, again, you want to deliver your message and your key points in 60 seconds or less. Consistency, again, you want to create a message that you can repeat in various formats and settings using various communication strategies and channels. And again, you want to create a message that you can articulate easily, and others in your community can also understand and also articulate easily. So this beautiful image that you see is one of our visuals that we've created at the National Resource Center that does just that. So Ann talked about the awareness plus action and how that will actually equal social change. So in using this image, our message is clear. It's an equation. There's a plus. So awareness is important. That's our intervention strategies. And the action is also important. That's a little bit bigger in this image because we wanted to put emphasis on action. And, of course, that will equal social change. We've also created an infographic that really explains the various concepts in words that you can easily communicate in your communities. So we will have a link. Yes, the link was already posted for that infographic. And the infographic, what it does, it tells you strategies that are connected to awareness. It tells you strategies that are connected to action, and it tells you strategies that, and it tells you the outcome that we desire. So it's a two-pager, easy for you to communicate and easy for others to digest as well. So as I move forward, what I want you to consider is, what is your agency's and your organization's current message about the relationship between intervention and prevention? So as I continue, let's think about that, because we want to shift that. All right, so this is another image that was created by our friends in Idaho. As you can tell, images are a great starting point when you're creating your message, because they can convey your message easily and quickly. We know that imagery is memorable, and images are processed faster than text. It allows you, again, to paint a picture of what you're trying to say very quickly if you have a limited amount of time. This visual is a great example of visual done well. It has the words. It's clear, it's concise, it's beautiful, and it's engaging. And it also sends this clear and concise message that gender violence is reinforced by oppression at all levels of the social ecology. This, the illustration here says, it shows how individuals, families, friends, and peers, community, and larger societal institutions are interconnected. And individuals do not act in isolation and are influenced by context and social structures in which we live. Another key message that can come from this one image is prevention equals proactive efforts to stop violence and abuse from happening in the first place by interrupting the cultural rules, norms, and constructs that support it. So again, you want to use words that are clear, you want to use words that communicate your message, and you also want to incorporate images for various reasons. So Anne talked about the importance of intervention and prevention, and the moving upstream analogy, which most of us are familiar with, started telling that story about the importance of awareness and prevention. But the story doesn't end there. We have to create a story that's tailored to the individuals, the systems, and the overall culture of the community that you're engaging with. That is the only way that we will move folks from increased knowledge to the action. We want people to act. We want our message to include steps that are doable, and we'll show you some more the ways that we've also incorporated that into our messaging at the National Resource Center. Storytelling is an excellent communication strategy for making this happen. We all know, and again, from the many years that I've done this work, I've come across, the individuals that I've come across in various communities, various settings, various sectors will agree that IPV is a significant problem with serious impacts. They probably also know the emotional, physical, and social impact of violence, may not be aware of the significant economic burden caused by IPV. You now have that information that you can share, and most people really do believe that violence should end. We should prevent violence from happening in the first place. But again, knowing that and acting upon that is totally different, and that's what we're charged with doing if we really do want to end domestic violence. So since we know that people don't act because they believe this issue appears to be too overwhelming, they don't feel personally connected to the issue, and they also feel like their small acts will make a difference. And I've heard this over and over and over in the field, and we want to change that. We want to change the mindset. We want to change the culture. We want to create space for everyone to feel valued. And storytelling is a communication strategy for social change that does that. Storytelling provides a concrete and easy way for people to get involved and become a part of the solution. It allows us to transform stories of victimhood to stories of survival. It provides the opportunity to create a narrative and a message that highlights resilience and hope. And it gets people really excited about data, believe me. And that's because you're going to connect stories to that data about people, right? And people are just naturally connected to people. And I'm sure you can also think about some other ways that storytelling is effective. If you're not aware of the Transformative Storytelling for Change project, please check them out. They offer a lot of tools and a lot of examples and a lot of guidance on creative and visual storytelling methods. So we're going to continue moving along. Awareness and prevention, the integration of both is just a part of the culture of our organization. So we incorporate many ways. We've incorporated the Awareness plus Action equals Social Change campaign during Domestic Violence Awareness Month and beyond. During Domestic Violence Awareness Month is an excellent time to engage with your non-traditional partners. But again, you have to engage with your non-traditional partners in a way that communicates that this matters and they're a part of the solution. All right, so we have another beautiful image here. And as I had talked about before, creating effective messaging takes time and takes strategic planning. This hashtag One Thing was developed by the National Resource Center Domestic Violence Awareness Project, which is comprised of a group of just amazing individuals. We have government agencies, we have community-based organizations, we have coalitions, we have survivors, and just a wide array of preventionists, a wide array of individuals as a part of that project that came together and decided that for Domestic Violence Awareness Month and beyond, we really want to be intentional about moving folks away from, not away, but moving folks from increased knowledge again to action. So One Thing was birthed from a 2-day intensive meeting and lots of great discussions. And as a part of that discussion, because we had diverse individuals at the table, what we came up with initially would have been challenging to translate in other languages. So we were intentional about coming up with something that would resonate with diverse audiences. So again, the nugget from this is effective messaging takes strategic planning and must include diverse voices. As far as One Thing, because we know people do not act because they feel like the problem is too massive and their voice is not valuable, the key message is change can start with only one thing. One person's action may seem insignificant, but together a community's collective one things can lead to real social transformation. The message is clear, it's concise, and it's consistent, and it's easily adaptable based on the intended audience. Again, for Domestic Violence Awareness Month and beyond NRCDV, we've been communicating our message as domestic violence impacts millions of people each year, but it can be prevented. It requires the collective voice and power of individuals, families, institutions, and systems, each whose one thing as a valuable and powerful component to transforming our communities. So again, One Thing provides a clear way for folks to get involved. It's doable, and it connects communities, it connects diverse individuals, and it offers, again, family, friends, and your community a tangible way to get involved. So you would need to get creative about your one thing. Again, awareness plus action equals social change. That is the campaign that we're using, that we've been using for many years, and we've incorporated the one thing. Some examples that can be offered to the field. We've offered some, and there's some new ones that really connect the dots between intervention and prevention are your one thing could be a caring and consistent adult in the life of a child. It could be create a culture of consent in your home. It could be write to a legislator and or a newspaper about the cost and value of prevention. You can also reach out to your local violence prevention program to learn how to help. You can also offer the opportunity for supporting women and people-owned businesses in your community, modeling self-care at home, at work. It is the use of one thing is unlimited. You can really create the message depending on your audience and who you're talking to. Again, when you connect this back to social change, each of our one things and collective actions are critical to ending and preventing gender-based violence. That is the message. It is clear. And building that pathway to ending domestic violence is an investment that we all must take together. So all of our one things collectively will create the change that we would like. Another amazing visual, and I must say before this visual, the other visuals that you've seen in this presentation and also just across various listservs and in our communication world, I need to give kudos to our communications team of 2 that does an amazing job at creating visuals that just take our content and scream it out to the world in ways that sometimes amazes me. This particular visual was created by my colleague, Casey King, using PowerPoint. So if you don't have a communications team, it's possible. Casey put together some images from the Idaho Coalition from a publication that they have and incorporated that into this slide. So again, various images are adaptable. They're eye-catching. Casey uses this slide in her presentations, and she focuses on the shared horizon. So quote unquote from Casey, together with other movements, we gaze upon a shared horizon of the change we wish to see. If we can work collaboratively as part of a larger social justice movement, alongside those with aligned goals, we can achieve the shift in culture that will end domestic violence. I also use this slide, but when I use this slide, I talk about beloved communities in my prevention trainings and just in day-to-day conversations. Beloved communities, when you talk about beloved communities, people feel connected. From my experience, people can acknowledge that prevention is social change work. You're using language, you're using words that resonates with prevention practitioners, other activists, allied communities. They feel connected. So I guess for you, you need to find that thing that connects you, connect the issue with other social justice organizations. Everyone can relate to the desired outcomes of a beloved community. Similar to Dr. King's belief, participants begin to believe that beloved community is realistic, it's achievable, it's attainable by a critical mass of people. Grace Lee Boggs also coined that term, and she believed that it called upon us to transform ourselves as well as our surrounding organizations, policies, and systems. So overwhelmingly, advocates, this resonates with advocates because the practices, the principles, and challenges resonate with individuals. The message, again, from Beloved Communities, if you're not familiar with that, look it up. It's clear, it's concise, and it includes a call to action. So, again, it's up to you to be creative and find ways that you can communicate and connect with your community and with your community members. It was also intentional that I started the presentation with the illustration from Idaho that showed us the problem. And here I am almost wrapping up with an image that illustrates our desired outcome. So again, it's all around being intentional. It's all around speaking with words and images to create this story that you want to create about prevention. Okay, so I just want to kind of head into my closing by introducing the PreventIPV.org. The website is in the chat. You can go to the website to learn more about the Prevent IPV Council. That's also comprised of coalitions, community-based organizations, etc. You can explore the impact that robust prevention efforts have had and continue to have across cultures in the United States. You can learn about lessons learned from innovative and groundbreaking primary prevention efforts, and you can also find a wide variety of tools that can be adapted for your community. You can also access our prevention e-newsletter that's disseminated 4 times per year. This is how you can connect with us if you have questions. Again, just to recap, key points, your 3 C's. Your message should be clear, concise, and concrete. Pull together this amazing data that you got today earlier in the presentation. Add stories, add quotes, include a call to action. When people feel like their one thing is valuable, they'll tend to act. Again, they'll tend to encourage others to act. So when you put out a call to action, you should also include what will the impact of their action be. So again, in closing, one final thing for you all is, what is the one thing that you want your key constituents and your policymakers to know about the cost and economic burden of IPC? And that is my time. Thank you very much.
Thank you, Arlene, and thank you, Ann, for sharing and all the fabulous resources from the National Resource Center on Domestic Violence. We're getting near the conclusion of this thing. If there's any last questions, this is the time to do that. I had shared earlier that in California we had done some work, and part of it is we really talked about the need to be able to make these investments and that we can reduce costs. And I love the point that Ann brought up earlier, that we just reduced by half the incidents, that we would be saving $1.8 trillion in our lifetime. And that's kind of a mind-boggling. And then the amount of investment that we need to make is much less to be able to do that. And so we need to be able to do that. For people that want to be able to download this presentation, I saw that question in there. Tori will post the link. It's on the PreventConnect website. We do have this. We will have a recording of this web conference that should be up maybe in the next, it could be tomorrow, it could be early next week, but we will have that up available. And that we really wanted to be able to highlight, here in California we highlighted the costs and how we can be able to do that, that you can talk about that investment. And we want to encourage you to use the tools that the National Resource Center on Domestic Violence gave you to be able to think about how to communicate, use the data from this report, and use the brilliance of what you know in your community to be able to make a change. And so it's really important that we can be able to find ways to be able to move forward. So I want to really thank today all of our presenters. We had Megan Kearns and Cora Peterson from the Centers for Disease Control and Prevention. We also had Arceli Vassal and Ann Menard from the National Resource Center on Domestic Violence, and we were joined earlier by Kenya Farley from the Department of the FIPS office over at HHS. And so I can't believe this has ever happened on a PreventConnect web conference ever before. We are going to end a few minutes early, unless if there's any last questions. Go ahead and put them in there. So I want to thank you all. You will be getting a link in a few minutes with an evaluation. Please fill it out. We do have this information available. And thank you all for joining us for today's PreventConnect web conference. We really appreciate it. And that concludes the audio portion. I'll keep the text chat open for a couple more minutes. That concludes our audio portion of today's web conference.
Thank you for listening to this PreventConnect podcast. PreventConnect is a project of the California Coalition Against Sexual Assault, with funding from the Centers for Disease Control and Prevention. The views presented on PreventConnect are not necessarily the views of the United States government, the CDC, or CalCASA. To learn more about PreventConnect, visit www.PreventConnect.org. For more information about CalCASA's mission, or to show your support, visit calcasa.org. That's CalCasa.org.